Good afternoon. This is the House Appropriations Committee. It is Wednesday, January 21st, 2026. It's just after 2:30 in the afternoon. And we are getting back to a BAA spreadsheet. Emily has worked on doing something, and it's a very fancy one this year. Extra cool things that are happening that she will tell you all about. And at the same time, as she says, we can also see if there are areas that we can close out while we're talking. And maybe Emily can even demonstrate how it works on a screen. It doesn't, you don't have to.
I probably won't, because James is gonna have it open, and as you go through, he's going to
He's gonna do the cool stuff.
the work.
So the combination of let's hear where we are, but let's also do some markup and get some things off the list that we can.
Yes, and this sheet is still a work in progress. Say that before we dive into it. Find the version that I want to share. Yesterday you received the budget, the 2026 budget, and it had to account for the revenue downgrade that was adopted on Friday. Those changes are not in the sheet that you have in front of you. I'm going to add tweak the governor's recommend column, make it governor's recommended updated column, and add in, and we'll talk about it when we get to it. There's a reduction in the amount of one-time money needed to go to the Brattleboro retreat for the settlement. There's some increases in some direct apps and reversions that bring it back into balance with the new revenue numbers. So that's not in here. It will be in the version you see tomorrow.
Revenue downgrade, yeah.
Revenue downgrade. I will share my screen and then walk through the details.
So you can add those things and maybe shade them with different colors. So it'll be easier to
Yes,
see them.
yeah, I'll make them a different color. All right. Work, here we go. Okay. So recognizing that last year when you all saw this budget adjustment sheet, I think more than half of you were new to the committee, and we're trying to figure out what a budget adjustment was. So just at a high level, this spreadsheet is taking what the governor put forward in that big spreadsheet that you have. I'm just trying to summarize all of it. The top part in gray, that's the as passed FY26. So that stuff's not going to change. That's what you would pass for appropriations, the pay act, one times, the transfers. So the 190, that includes the 77 million that went to the education fund, along with other transfers. The contingent appropriations and transfers, and then what went to the reserves.
So that's what we actually did.
That's what you actually
Can't
did.
change what we did because we did it.
And that won't change. That top part will stay the same across House, Gov, Senate. That's just a reminder of what happened and where we're starting. So then starting on the orange section, these are all of the adjustments that are listed for the general fund on that big sheet from the administration. The ones that are grayed out with the check, there's now the new feature, there's the little check boxes. And then so you can check.
So as soon as you check it, it turns gray.
Right, in our spreadsheet. So as you check things off.
You give it, can you demonstrate or just?
James has it open. But so as you close things, we'll check the box and it will gray out. And then you'll know that those are ones that you've settled on. We can always open it back up if you need us to, but.
You use a lighter shade of gray?
We could use a lighter shade of gray. Yes, we
That
can.
actually
It's difficult.
Yes, that's good feedback. So yeah, so we put in, what's grayed out already is what you talked about on Friday, I believe, and made some decisions on.
Hopefully that looks familiar. Right, hold on, rebate,
Yeah,
one judiciary thing. Police overtime, military.
yeah, and then the description is, our attempt to say what it is in a few short words. In the notes section, this is where we tried to reference, right, if this is something that has federal match or is, a part of a global commitment thing, this has the detail in there. Needed. And again, this is just the general fund pieces. So, and as you make decisions, we'll fill in the House column. If you pick the same number as the governor, we'll put the governor's number in the House column. If you want a different number, we will fill in a different number. And add rows as needed if there's things that aren't on the governor's list that you all decide you want to put into the budget adjustment. And then
B ones, remember the base, B is the base.
Yep.
And then later on, we have one times.
later on, you've got the one times. And the changes in yellow on line 81, that's the Brattleboro Retreat Reconciliation Payment. I just highlighted that one in yellow because we know that's a new number.
We know what the number is too, but you're just gonna put it in on the governor's side.
Yes, we'll update it in the governor's.
Right.
Updated.
5.1 or something like that.
That's just more to signal to us. Same with the pilot special fund. That I know there's been some discussion about whether or not that transfer needs to happen from the general fund to the pilot special fund. There's also a transfer from the transportation fund to the pilot special fund. There's an open question on whether or not that needs to occur. And then on the bottom in green, this is the revenue picture. So just like at the top, those first 4 lines, that's what was as passed. That's the forecast that was used in the original budget, what the reversions were, direct applications, and what was carried forward from FY 2025. Below that are the adjustments for the budget adjustment. So we have the updated forecast, which includes both the updated forecast and accounting for the sort of revenue changes adopted by the General Assembly. You'll recall there were some tax credits adopted by the General Assembly, so that counts for those in that 88 number.
Wouldn't the tax credits be a reduction in revenue?
Yes and no.
Nothing is ever simple.
Nothing is ever simple.
Yeah.
I'm glad Chris is here. This is one that we have talked about how to explain. But when Tom and Jeff do the forecast, they compare forecast to forecast. You guys effectively adjusted the forecast when you did the tax credit reductions, which Tom then had to take into account this new forecast. So you have to account for the fact that Tom's going forecast to forecast, but you played with the forecast. If that makes any sense. So then you're not really.
Wouldn't that be July?
Yes. So, and this is the this is still the July forecast. This hasn't been updated for the new forecast that you did in January.
Okay, but where did the 88 come from? Because I thought it was 77.
It's 77 plus the tax credit pieces. I have to figure out a better way to explain.
Okay.
But it's a change, and it also includes the property transfer tax changes. So they
Right.
forecast the property transfer tax transfer to the general fund, so that number also gets updated. Together a sheet.
Okay.
There are also some additional reversions in the governor's recommend, some changes in the direct applications or transfers to the general fund from other funds. If you go all the way down to the purple section, you'll see the balance, 74.91 million. That's the amount that the governor is proposing to reserve in FY 26 to be carried forward into FY 27 to dedicate it to property tax relief.
Then say reserve for FY 2027.
Yeah, correct. James, you can go ahead and tweet. But yes, that's what we reserved in FY 26 for FY 27. And yeah, so as we fill in those, once we update it for the revenue forecast and the new revenue forecast, plus the changes that the governor is proposing, he's got some additional reversions and some additional direct applications to help offset the change in the revenue forecast. We'll fill those in and then that will rebalance back out. to.
Right, and we're in deficit on the House side because we haven't made all the decisions that we need to make.
Correct. We haven't put in all the numbers.
Not to just
I
completely
was
ignore
gonna
at this
say,
point.
right.
Totally ignore the house column at the bottom line. Finish making choices. Yeah. So that's just an orientation to the sheet. I think from here, if you want to take it in terms of going through
Yes.
individual line items. Closing
I'd like to do that.
One more question, just about the
Yes.
sheet. So you've got red and black, obviously, and you've got red in parentheses. The black numbers are additions that the governor would like to spend.
Yep.
And the red ones are where he sees some reductions.
Haven't lost it, Marty.
Yeah. If it's a wire? Okay, I got it.
Okay. Is everybody sort of oriented and kind of know what we're talking about? It sounds, starting to sound familiar. We're a few months away from spreadsheets. So let's start checking some more off, so you guys can gray off more things in later gray. Maybe we can have a few choices we can look at for, but a couple of shades I think. But let's just start up at the top. These are yours, Trevor.
Yeah, I think we'll share. I thought we picked those.
Uh,
I thought we did.
Actually, I do have check marks, the
Yeah.
204 and 207. Well, 204 we closed, which is judiciary.
207.
207 is good.
207. There's several 207s.
Yeah.
Oh, because you're using all the numbers, the things over on the right hand side. Okay. Everybody good with that? I'm not hearing, not so.
All 207s?
Yeah,
Yeah.
15, 16, and 17. Oh, 8, Marty, this was you.
Yes, and I'm. This is where. Yeah, 760,000 is where they're moving it from the interdepartmental fund to the general fund, because this is where their indirect costs from the grants do not cover their full administrative costs for related to the grant. So in order to cover that, they need a supplement from the general fund to the tune of $760,000 to make it even. And I did ask about that, is there a better way to budget for that? And he says, well, sometimes they can and sometimes they can't. It depends upon the types of grants they have and the conditions on the grants they have and how much administrative work is really associated with. So it's kind of a catch can. And in the past, it just gets made up by the general fund because the indirect costs that are allowed with grant money doesn't cover it specifically. They've gone a couple of years and not having to do this because they had some carry forward that they can continue to use. But now they're at the point where they need to fill that hole in the budget for 760,000.
People have
Whatever this number was.
questions about that? There's two different pieces. One is vision and the other one is the HR internal service fund.
Right.
Trying to find my updated. You have an updated carry forward report. On one, but this would have been in this one.
But it wouldn't show.
Well, it might show that there's zero, right?
Oh.
Sometimes we find.
Oh.
This is DPS. Yeah, they have an interesting collection of things that they have left. State police, they have base. Left of 350,000, and they have a lot for high flood risk and regional dispatch. We're working on regional dispatch.
Yes,
It's still
yes.
here. It's still here. FEMA match, so I'm not seeing anything related to that. Sometimes we find things in here that we could actually be using elsewhere, so.
Oh, I see what you mean.
but it doesn't seem like we are here. So are people okay with into this one? Anybody object? Okay, we can close that one off. And we have, similar to some of these other ones, so that's a contract increase. The theme seemed to be the special fund that's supposed to pay for this doesn't bring in enough money to pay for it.
Exactly.
That's a common theme in various places.
Mhm.
And then we have, the IT system is costing more than we thought it would.
Well, yeah.
That's another one.
Mhm, mhm, mhm.
Um,
So that's are we gonna
Yeah,
cross off this, the B208, the internal
Yeah.
service fund?
Yeah, we can check that off.
Okay,
But then we have criminal justice services.
right. They had and were approved a couple of years ago to move this particular platform, Criminal Justice Council platform, to the cloud. And they were approved to do that. They were intending to use money in the Criminal Justice Council Special Fund to do that. Well, that fund has since gone kaplooey.
Another one.
And, but it's already been approved to do it, and no, that's not the one there, right way through, but they are obligated to do it. And so they need this extra $570,000 to finish it.
And that will finish it, you think?
That will finish it,
Okay.
yes.
So we won't see this one again. Tom?
Going back to your statement about the special funds not having enough money in them, is this a case where these special funds are being funded by fees that we're not raising or that we're not collecting or that use is dropping off, or what are the other sources of the special funds? Because we heard in the budget address that we haven't raised fees, and we know that fees are for special services and for special funds. Is that what we're fixing here with general fund dollars, surplus dollars, that when we talk, when you break it down into just simply saying the special
Right.
funds are not fully funded?
And I think you nailed the two main themes. One is that we haven't raised fees in some cases, and in other cases, whatever was being used, there was less of that happening. Just like with gas mileage is going down. So we have, and there's been some in judiciary, I'm trying to think of them, but I'm not, it's not coming to me immediately, but there were fewer people doing a certain crime or something that they had to pay something for. And so, I mean, that was good news, but then we weren't getting fees, so the funds, and this is a problem that we have with special funds, right? Is that it so often doesn't work over the long term.
Well, the fees in this case, in this particular case, there might be other reasons for that.
Yeah.
But in this particular case, again, if fees are not rising to the level of the expense, I mean, we saw this with the DMV.
Right.
We're gonna see it, we're gonna have it in FY 27 with the agriculture, with the waiving of fees that farmers and
Right.
others or agricultural businesses would pay, that the general funds will then take a hit for, I don't know what the number is, I just got it from let's say $300,000. Sounds like nothing, sounds like a drop in the bucket, but if we are, again, this is one of those things that I think fundamentally we're shifting how we're paying for things
Yeah.
constantly. And then how many years later saying, well, we have to shift it back. We're seeing it with the
Right.
T fund. So it's just pointing out, like, how do we get a handle on how the administration is treating income and expenses and how we're reacting to it and how we want to see. I mean, we can't argue with the fact that we need to pay for ADS, even though we don't like the thought of paying that much money every year for surprises.
Yeah.
So I'm just curious,
Yeah.
like, how are we going to move forward with? I mean, it seems to me it's always been a fundamental thing that gets passed off by saying we're saving people money, but fees are there. If you're buying a hunting license, it's because you're a hunter. If you are paying into the clean water fund, it's because your farms may be resulting in the need to have a clean water fund as opposed to somebody else who's not a farmer. So, and it's not a question of why should I pay for that, but that's what we
Right.
hear about everything else.
Yeah.
So is that for us to address? Is that for the policy committees to address? Is that for a different, a different way of looking at it? I'm not sure, because if I just check this off by saying special fund that we just need to fill for the tune of whatever
Well, we
this
should probably
is.
get rid of the special fund. I mean, there is a theory about not having special funds or having very, very few special funds and putting everything through the general fund, and then you really know what you've got. These dedicated funding streams rarely work to the benefit of the organization or entity that wanted them in the first place, because they don't always last. And yes, we have an issue of not having raised fees in 10 years. So, but there's sort of the philosophical way to account for it and use it, and then there's the raising the money. So there's sort of two separate things.
Right, it's just that we're outside of inflation. Right, that's what the 27 budget represents is inflation.
Yeah.
If we keep putting pressure on the general, if we take away a funding stream and expect general fund to take it, there's a ceiling here if we're not raising taxes or fees.
Right. And we put all the money in the special fund into the general fund, but it still wouldn't be enough to cover.
But sure, I'm just like, this dilemma is I mean, this is what I saw clearly with the proposal for the agricultural stuff. Again, I have no opinion on it intellectually, but just the idea of saying, well, where's that $300,000 going to come from? And if we're not raising other revenue, and then if we're using all of our excess revenue to pay down property, I mean, just.
Yeah.
It's just not, I mean, I know accounting isn't that, for state funding isn't that straightforward. I mean, we just heard 3 yes and no answers to
Right.
to a question. So I just, my non-numerical brain is just I'm just.
Yeah.
Please be patient with me when I ask stuff like this. I'm trying to align it in a way that I understand.
Yes, well, and that's not always easy either. I mean, not you, but just in general, it gets to be complicated. Wayne, any
It's
questions?
complicated. Some of them were built like the Fish and Wildlife Fund license sales. The intent was that sportsmen were hunting and fishing, that they should pay for management, some wildlife, the fees that they
Pay for what you use.
Yeah, and then same thing, like the other issue that we heard about recently was that, your background checks, there are fewer
That's one of the ones, yeah.
background checks
Well,
being
that's
done.
on the second page, and I can tell you about that one.
And again, those are, the intent there was to have the people requesting all those background checks pay for it rather than having the general public pay, portions of that. So you'd have to look through every line item in state government, look at every special fund and what the intent was for every single one, and the intents were different, different ones. And decide, and again, it's a philosophical thing and it's political. So.
Well, we have the list of them.
So it
At
could-
least
if
it
we-
is in 24 pages.
Could we unsnarl that mess? I don't know.
Okay, let's continue. We're gonna ignore that. So did we agree to that one?
Which back to 570?
Yeah.
Which one are you agreeing to?
Line 20, 10. And then you have the criminal justice council.
I have the Criminal Justice Council, and that's an interesting one. It is they're doing a complete review of this is the Criminal Justice Training Council, where people go for 16-week training to become a police officer as well as go do other things. They were having a complete review of all their curriculum and updating it and, updating materials that they use and using it with new classes. Anyway, it's like a 3 or 4 year process. And they need $300,000. They started out with an appropriation from the legislature for 1.2. It turned out that they were going to need another 300,000. They needed another 2, but they took that for some background from a special fund that they had sitting around that they could use. And then they needed another 300,000 in order to complete the project, which they had a bid for it. But they apparently were only appropriated 1.2 instead of 1.5. And we're told to try to figure out where to come up with 300,000. And I've searched it back through. Apparently for 2 years, they asked for one-time money and were denied both times. And it was apparently in last year's budget, although I don't find it in your official notes of a one-time thing, but I find it in the committee's recommendation that they put in 300,000 for one-time money to complete that, and that was denied. So now they're in the process of having all this done. They have a contract. By next September, they're gonna need this $300,000 to start paying their last payments on this contract they have. So it's a process, it's a program in process. It's been in process for 3 years. It's coming to completion. They're gonna have to pay the vendor when they get to the last 6 months, and they don't have this $300,000 to finish paying.
So do they have to pay them in September, or do they have to pay them in this fiscal year?
No, they pay them monthly, and that was my question. Do you need it right now, or can we
Right.
put it in the next budget? They will need it by October or November in order to have enough money to finish it in September of 27. So it either needs to go in the BAA or in the regular budget. And I would think it would be easier just to throw it into the BAA.
Yeah, I to remember it in the budget. Anybody else have an opinion on that?
But once that's paid, it's done.
Yes, yes. I mean, they're working on it. But they're in a contract with a $40,000 a month payment, and they're gonna be 300,000 short if.
Okay. So people okay with doing that?
That's-
Okay, all right. Let's check that one off.
And Marty, I'm sorry, was that 1.5?
The original quote was 1.5. They were only appropriated 1.2.
Okay.
Whatever.
So the price hasn't gone up.
Oh, price did not go up. It's
That's
just,
kind of amazing.
I think, I don't know. I can't.
Yeah. I don't know. Okay. And Emily, do you want to explain line 24?
Sure, for line 24, so there was, in the human services budget adjustment, they put all of the costs for the human services SLA in AHS central office in the FY 26 budget build. And then in the budget adjustment, they're taking it out of the central office and then they're reallocating it back to the relevant agencies and departments. We did a double check to make sure that that's a net zero impact. It is a net zero impact, so it doesn't increase the general fund. So that is just a lot, rather than call it out 6 separate times, since it's a net zero impact, we just put it all on one line that it's.
Everybody got that?
We're gonna make a decision on.
Thank you. Okay, Lynn,
Going out for.
we're good on that.
Yeah, okay, the Secretary's office on line 25 is the federal fund reconciliation. That's 540,000 general fund plus federal revenue for the reconciliation personal services. I don't really know any more about it than that, but that might be, there's obviously transfers here, or they're taking out a general fund, they're taking out the federal funds. It's a total negative of 4 million plus. That's for all of those things, including the ADS, general services.
So that's a reduction in general fund of 2.1 million.
Yes.
Where are we? Sorry.
On the,
B 300, which is the secretary.
All of them?
All of them.
Well, part of it is the ADS, actually, a couple parts of them there. They got a total 5 million plus, and they're adding 1.171 million. And that is for digital services level agreement charges. It's charged to the Agency of Human Services. I'm not sure how that works with you taking it all out and then redistributing it, putting it in and redistributing, but you figured that all out already.
I think this is additional on top of the service level agreement. That's,
I'm trying to figure that out with Adam's
Yeah.
spreadsheet.
Yeah.
It's not working. That's what we're having trouble with.
Yeah, and there's federal funds in there as well. So that's the 9.
According to this, yeah,
Well, that
right,
is,
digital services 1.17, that makes sense, but the
the little, some of you gotta look at the columns and the explanation
the
sometimes.
general fund says minus 2.1 million on Adam's spreadsheet.
Oh, you know why? It's this SLA
Oh,
change, right? So the SLA, there's a big chunk of money for the
Yes,
SLA
right.
that's going out, right? That's why the total
okay.
is less.
is less, and it
So
doesn't
this is
show up
really
that way.
539,000? Except yours says 540,000.
I think it's,
I guess it rounds up.
Right.
So that's the general fund piece of the revenue reconciliation,
Yeah,
which I don't know what that is, but sounds like we have to do it. Wow.
well, it's only 539,000 for the general fund.
Right, but it rounds up, this system rounds up, because you just go to two, we just go to 2 decimal points.
Okay.
All right,
General fund reduction.
reduction, so we like that.
Yes.
Everybody okay with the general fund reduction? Okay, let's check that out. And then the ADS invoices,
The ADA invoices are what they are. I mean, we
Yeah,
heard from
they
them,
are,
that's
that's
just what- and we hope that they get work day going real quick.
right? Okay,
So that one I would say is okay. Then global commitment is the mixing bowl. You take things from
right,
choices for care. American Federation, that's a collective bargaining piece that was lower. We have family planning rate changes not being executable as drafted. I'm not exactly sure what that is. And then general fund Medicaid census, that's down. Because I think we had reduced reduced caseload. So there would be something for that. And then you have the adult caseload utilization changes as part of it. And then there's an increase in the general fund, federal funds for department global commitment fund adjustments. I'm not exactly sure what that is, but
I think that's the increase because of utilization.
we had
Caseload's down.
with utilization, but lower case.
Fewer people, but they are, those who are there are utilizing services.
It's all been mixed in, and that is where you combine your federal.
Right, so,
Global commitment along
right,
with your
so this is
regular.
the sum of all the ones that happen in all the other human services ones.
And
Yeah,
I
usually we do that one last, but I don't know if we need to make any changes or not.
Yeah, well, of course, then we still have a thing, it's not on mine, but in B306 is the DEVA administration cost. And that has to do with the service level agreement changes transferred. Okay, this is the because that's, that's when it's 252,000. This is the lease for the expansion of Pilgrim Park necessitated by the closure of the Vermont
Yeah.
Department of Health. That is okay. That is part of the mixing bowl. Not quite, I have an asterisk here to indicate that it's up there.
So this is the return to office.
This is the change in the
Cherry
office
Street.
space from Cherry Street. And
Yeah.
the way I talked to Tracy O'Connell about it, because I asked Alice over the weekend, she didn't really figure how it worked. But BGS pays for the lease, and then they charge it to AHS, which can then draw down federal funds. Global commitment.
Okay.
So that's how.
So we know that the total was, 438,000, I think, but 252 is general fund because we can draw down federal funds for some of it.
So that's included probably up in some of those global commitment funds.
Right, this is actually Dave's area. So
Yeah.
I'm gonna ask Emily, should we hold off on global commitment for the moment, 301, just hold off on that?
I would, I think the individual line item, what is tricky, right? We'll use the American Federation of State and County Municipal collective bargaining. So
Yeah.
like that's the impact of the change across all of the, like you'll see it in Dale is where those changes happen. So if you accept those changes, right, the need to increase Dale's global commitment appropriations in accordance with the collective bargaining agreement change, then you would also, that would be sort of the confirmation of the change that's going to happen in B301, because that's where you're going to get the federal and the general fund to come in to pay for that global commitment appropriation. So I think,
Okay, so we'll hold off on that one.
So we'll hold off on 31.
Right, so 306 is Dave's.
Yep, want me to take this now?
Yes, Dave,
So
please.
B 306, there's, I think, 1, 2, 3, 4, 5, 6 Diva admin changes. None of these were rejected by either of the policy committee. Now,
Okay.
having said that, if James or, I don't know if Nolan's here. The notes here are skimpy. Maybe before Stephanie leaves, maybe she's already left. She's gone?
Yeah.
Okay. I thought maybe there was someone that could help enhance these a little bit. Let me just run through them though, quickly. So, because I don't want to say on the chair would not want to say on the floor. Policy committees agree and then move on. Hopefully, nobody will raise these. So the first one is the, hold on 1 minute. I'm in the wrong line there. It's the swap of the federal funds for Planned Parenthood. So as I understand it, the feds took away the federal support for Planned Parenthood and we're putting in general fund to cover that. Is that right, Emily?
that's my understanding. Yep.
That's my
And
understanding.
that's for primary care, non-Medicaid services.
Yes. Yep.
So, yeah.
Actually, 307.
It's in a couple places.
It pops up again. Then the next one, the medical provider contract increases. It says increases. The one I know about is it's called MEI for the federally qualified healthcare centers for primary care. DIVA historically, almost always, bumps up the primary care rate to correspond to what the Medicare rate is. Not a huge amount of money. Anyways, that's what that is, but I need to just check with somebody at DIVA. There may be 1 or 2 others like that, and I just want to know what they are.
Yeah.
It does say increases, and I know of one of them.
Well, it says, medical provider contracts is what they are. One to Dr. Klein to provide clinical mental health services, another to Dr. Schulten's contract extension for prior authorization reviews.
Okay, is
Those are
that,
the 2 increases.
yeah, I think there's another one that pops up with the MEI, but I'll keep on going.
Okay,
Maybe those, is the next one I think is Oracle. Am I skipping the one for the DIVA staff? The Oracle license increases, it is what it is. The next one, the Gainwell contract amendment, they process all the Medicaid claims. I don't know what the amendment was, I should find out. And then the Medicaid data warehouse.
Yep.
And analytical solutions. So there's some IT work going on there that they've incurred, and it's over $1 million, 1.4.
well, and that thing's been going on for
And it will,
years or,
and I suspect it will continue to.
yeah.
And then
So Dave, of those, are there some you're ready to close out?
all of them.
Okay,
I do want to, and James helped me on this. There are 2 additions that I'd like to, we've heard about both of them. And I think they go in the 306, but I could be wrong. One of them is, you might recall, Robin, your transportation director, Jim Moulton.
yes.
That's $800,000 for Medicaid transportation. I was thoroughly sold on it. Makes great sense. Make a long story short, DIVA did not adjust their reimbursement as they typically do. But these Medicaid transportation providers for people who can't drive a vehicle on their own, many of them in wheelchairs, et cetera. The transportation provider is paid $47 per week per member. Some of the people might use nothing that week and others might use 97, but it averages out to 47. It's been running greater than that, however. And it has not been adjusted. It needs to be adjusted. They're another provider that's headed towards cash flow problems.
Right.
Bad things will happen if people can't get to their medical appointments. And also the landscape is changing. They told me up in the Kingdom, I don't know if it's your hospital, John, but one of the hospitals stopped doing dialysis. So the North Country. So the people have to be transported quite a ways further for their dialysis, maybe 3 days a week. Those things are happening, that they're making much longer trips. So I guess I'm trying to say, I don't know if we would add a line here, B306, medical transportation, but I wanted to flag it.
We will, that was one of the things that came up in the public hearing. So we'll talk about the public hearing things.
So should I skip those?
So we will, thank you
Okay,
for flagging it. We will not decide anything right now. That'll be part of the conversation of here are these other requests. What do we think about those?
thank you.
Okay,
And thank you. Then I'll move on. Then I was going to speak to the 2% AAA increase, but we'll do that later.
yep.
Then the B309,
Did you have a question, Emily?
Yeah, do you want us to find out, like, if that's a global commitment?
yeah,
Yes.
where does it, and James looked into it, right, James?
Yes.
You were very helpful.
In FY 25 big bill, you all amended the one times the FY 24 BAA and provided one times for any EMT for non-emergency medical transportation, probable commitment in the vehicle.
Okay, so let's check that out.
Most recent supplemental funding is done as a one-time.
Okay, so I don't know if we, thank you. Yep. And then the Diva 309, of which there's two of them there, I believe. Let me just catch up to it. I'm sorry, there's three of them. State only. Caseload and utilization increase. I can't see the notes if there are any.
That's for that one.
Regular old Medicaid.
Okay, funding swap and federal funding loss. Again, this is the Planned Parenthood of New England
Right.
swap that they had to do there. And then the clawback, and the clawback, as I understand it, is the federal government takes back some of the reimbursement they gave us for pharmaceuticals because we get it elsewhere. Okay, and I think we should close on this.
Okay. Any questions? So we'll close on all 309? Okay,
Then 3010, Diva admin waiver matched. I don't know what that is. I'm reading it.
it's zero.
Well, it sounds good.
It's swapped.
Sounds like a nice one.
Yeah.
It's the swap. It is what? Very small amount of money. $4,000 worth of general fund, which is why it rounds to zero,
Okay,
but it is there.
yep.
Okay,
And then there's
there, okay.
and then there's another one, non-waiver matched underneath it, right?
Yep,
And that's the Children's Health Insurance Program
correct.
for caseload and utilization. I can't see how much that is, but it's 170,000, is that?
Yes.
Yep.
Yeah.
And then I think that's it in the
That's it for
310.
you, yep. Thank you, Dave. We're back to Lynn with 311 and 12.
Okay, well, health administration and support. That's 311. See it says three,
That one's not on here because it's only the SLA.
only, yes, it is, yes, it's only that.
So it's in that big, it's a
Yes.
net zero impact to B11,
Yes.
B311.
And the public health is a swap of $300,000. This is the family planning service grant to Planned Parenthood. And it was taken out of general fund and taken out of global fund, put into general fund, taken out of, so an even swap does not involve the Planned Parenthood. I would say that's fine.
Okay,
Lots of federal money.
right. Okay, so that's line 39. And then we will move to TIP.
Yeah, so, so the healthcare committee in, both 314 and 315, had no problems with any of these. I mean, they're PNMI, utilization, adjustment as in many categories. And, heightened transportation costs for youth and adults. And there was a federal revenue reconciliation. So the healthcare committee was fine with all of those, as am I. And
Everybody all right with those? I'm not seeing any objections. So those are all the 314s. Line 40 through 43.
Mhm.
Okay.
And the thing of note, I think, in this line item is basically it's a swap in essence, right? It's the total, it's vacancy savings. In vacancy turnover savings, in personnel services, kind of, makes up for increased travel nurse contracts. Which, I mean, in both, once the vacancy turnover is 4.5 million and the traveling nurse contract increase is 4.9, so.
And this is just for Department of Mental Health, it's not what we heard about today.
Yeah, yes, it's just the mental health facilities part of their budget. Yep.
Be interesting to know what they did last year. That's a curiosity thing. It's not a budget.
Yeah, in terms of the visiting nurses.
Yeah, is that going down or is that?
Well, I have to look. I
Yeah.
don't remember offhand. It is going, well, the overall ask, I mean, my first year on this committee, it was a huge number.
yeah.
It was, I think, close to, what?
80 million?
No, but I think it was close to like 25, 30. I mean, it was huge. And that has gone down. But it still results in, and I don't really know what I've never seen that in a spreadsheet before, vacancy savings. Nurses and nurses like, that. I mean, there must be vacancy savings in all of these line items that would offset costs, right?
Yeah, I think this is just a specific adjustment of like, we're taking it out of, we budgeted to pay for staff. Yeah, we don't have the staff. We're having vacancy savings associated with that. We're gonna take that savings and we're gonna redeploy it.
Yeah.
To pay for the contracts.
Yeah.
Yes, there's vacancy savings everywhere, but this I
Everywhere.
think is a unique case. It's more than what they budgeted and we need to spend the money.
Yeah. And they're showing where they have it. Yeah. So we can cross that off.
So 315, everybody
Yep.
good on those lines?
Yes.
Okay. That's 4 more down. DCF administration,
That would be
Dave, is that you?
Mhm.
B 316?
Yep, hold on, catching up. It was just there.
Yeah.
E315. There it is. Yep, DCF admin,
Yeah.
the TANF funding realignment. Is that the one?
Yes.
Okay. The $1 million. I'm not that familiar with this. It says, is this the one that's net neutral?
Yeah.
So they're swapping the money for federal funds? Or with federal funds?
They're not earning as much federal funds. as they-
They're not earning federal funds, so they're making it up with GF?
I love it when they say DCF net neutral. That doesn't really help because we care about general fund net neutral, not their net neutral.
Okay.
Right, I believe it shows up in B 317, BPF Family Services. There's a reduction in general fund, because they're gonna use more TANF funds, I believe. And then in administration, they're gonna use less TANF dollars and then use the general fund instead. So it's just getting the TANF dollars in the appropriation where it's gonna.
Oh, yeah, so that's what they were doing, is they were taking it and putting it in the right department, so there's these 4 transactions, so they should both be okay. A million, what is it,
On
70?
line 51 and line 48.
Okay, so why, we can just check those off, 51 and
And
48.
there's, the next one is their income, if I'm correct, the income verification system.
Yeah,
I don't have a note on that, but it speaks for itself. They're making upgrades to that system.
are you okay with that?
It's just
Okay.
the federal change.
That would be, line 49, it's $50,000.
Oh, the income verification.
Yeah.
Gotcha.
And then there's in family services.
Yeah.
The subacute, my understanding, there's a subacute adoption coming up. This is, I believe, for residential care placements that were more than what they had, are running higher than that they thought they were.
Subacute caseload and utilization must be higher. Good on that one, folks, that's line 52. Sounds like we have to kind of do that one.
Line 53.
Is that line 50?
No. About
Line 50, and there's, I think, the sub-adoption. The fund for
Substitute care.
substitute care, thank you. Caseload utilization is down, but the need for. What's the other one? Substitute adoption caseload is up, so there's.
Okay, so there's 2 of them that say sub something, and it's about utilization, so.
And I explained a couple of weeks ago, the adoption one, whereby the children, when they're adopted at a young age, they don't display any abhorrent or outstanding behavior challenges.
Yeah,
Often as they hit puberty, they're almost like a different person, sadly, to the parents. And they haven't received any training on how to deal and de-escalate. So some of them actually try to give up the adoption. So the state increases sometimes the subsidy and the therapy for those families. These go in waves.
yeah,
They're almost predictable.
okay,
And so I would close that out.
all right. And then we have the transportation contract increase.
Yeah.
Seem to be underfunding, that's another theme, we underfund transportation everywhere.
Yeah.
So everybody okay with that one? Okay,
It's the next one, the ABD.
yes, it is.
So that's one I think we're contract out for Social Security Administration to do the aged, blind and disabled payments. And they do annual increase, an inflation increase periodically.
And they're both a reduction.
This one's a reduction in the
I'm sorry.
caseload.
Oh, so then caseload's running down a little bit, sorry.
Good on that, everybody? Good, sir? Okay. Then we're at DCFGA, is that, are we back to TIF? Is that you?
Yeah, it is.
Okay. Yeah. That's good.
So, I would like to, well, I would like to recommend that we hear from Chair Wood again, or at least after today's testimony, I feel the need to check in with Chair Wood
Okay,
on
so we'll hold off.
all these things. Yeah, I don't feel comfortable with where we are.
I think we had a lot to digest.
There was a lot to digest and there was also conflicting information. So I just need to better understand why.
Okay, that's fine. So that would be 321, 323, and 325.
Mhm. I'm sorry to do that to us.
No, it's all right. We have time. And then what about the secure residential? We agreed with that.
Yeah, that is okay.
Okay, so line 60, you can check off.
At budget time, however, I think, I think her committee is gonna dig into that line.
Yes.
Yes, to better understand the total cost.
Okay. So that's fine. You go do your checking. We'll talk about DCF tomorrow. And then we're back to Dale. David, is that you again?
Am I on the other side of the page here?
Yes.
61, 62.
Line 60,
62, 61 and 62.
61 and 62, Dale, grants. I see the number.
Oh, that's the collective bargaining.
Yeah, that is what it is. They're the American Society of somebody. Actually, is that what it was?
American Federation.
Thank you.
County
Yeah.
municipal employees.
So that's line 62.
That's 62.
Line 61 is federal fund reconciliation.
Over in the other one. Well.
I don't,
well,
does anybody see a note with that?
This one's an AHS net neutral.
Yes, they're taking it out of, federal funds are being reduced and general fund is being increased.
West
Okay.
River Building, whatever, it was sheriff's office. It's a secure. This is secure.
Says net new cost of 79,804 across all those.
I don't, so far, nobody said anything I actually
It was in the
understand.
thing we just.
Oh, it has to do with the collective bargaining. Forward plan. This year, come back.
So the 130,000, that's what that is?
Over there.
The 100,
Says federal fund reconciliation for $130,000.
Yeah.
and the notes on Adam's sheet are that it's an AHS net neutral. We'll figure out where the other net.
Okay, so let's hold that open until we know a little bit more.
We closed 327.
Yes, we closed 327. We've kept open on that top. We've kept open line 59, line 61. And now we're getting into DOC. So we're talking.
61 is open.
61 is open. 62 we closed. We closed 60 and 62. And then Trevor has his turn.
Okay, the first one is, it's really a swap for general fund and global commitment based on the time study that was done that made more services eligible for global commitment. But it's essentially net neutral.
Okay, so this
That
is,
should be fine.
this is,
333 and 334 on Adam's sheet.
those
Are
are,
there no general funds? Oh, there are no general funds, that's why.
yeah, this is just.
Gotcha.
So let's go back. So we're doing, wait a second, I've lost.
We're on
330.
63, number
Okay.
63.
Yeah, I want to find it on his sheet too.
It's the very top one on the spread, the initial
Oh.
spreadsheet,
Okay, oh, yes.
where it shows it down.
Yeah,
When you look across on the correctional services, there's a couple of items on the correctional.
yes, it's quite,
services. But you
okay,
can see the 2.5 under the goal,
yes.
okay?
So that was the funding source. So that's a good thing. It's
Yeah.
getting some general fund. So I'm assuming everybody's okay with that.
Trevor, what's the random moment times?
I don't really know.
Emily, do you know what it
Time
is?
study,
It's a,
that's what I do.
not being an expert in accounting, but it's a way for these departments to do a like, what is an individual working on all
Mhm.
day? And they
Time motion study.
look at it for a period of time and then that snapshot, they apply it to like what they do over the year as a statistic.
It's like when we go out and count people who are experiencing homelessness, we're at a point in time.
But they're able to use that, like that time period of like, what were those employees doing in that time period to extrapolate what they'll do for the rest of the year. And it's sort of an approved methodology to say like
It's just a statistical.
statistical thing, yeah. So that you don't have to track every specific minute, 365 days a year. I can't remember how many minutes there are in here. I should remember that red song.
There's a song. that-
Yeah.
Okay, and the next one is just the air conditioning?
Yeah,
Mhm.
related to facilities.
Yeah,
That's good.
people okay with that? Okay.
Sheriff's transports. just an increase in cost there.
See,
The Southern State, it was one of those items that apparently was under some different agreement. And then all of a sudden I got a bill for it because the agreement expired, so they hadn't budgeted.
Oh,
So that's what that is.
so that's an unexpected expense.
Yeah.
They have to pay, okay? Everybody seems to be okay with that? Okay,
Hotel costs for employees, this is money set aside for those employees, usually correctional officers, that have put in shifts and have to come back for another shift. And so they have money set aside for them to stay in a local hotel if that's deemed necessary.
they're having a lot of overtime.
Well,
And
some of these
staffing
people are
issues,
sleeping in their
right?
cars.
Right, this is related to mandatory overtime, it's just incredible under capacity.
Yeah, so it gives, it provides some money, it's some flexibility for people to make that decision.
Are you okay with that? Looks like so. Okay,
The 3.17, which is the well path invoices, I'm gonna keep this open, and the reason for that is that there's 3.17 of an invoice from FY 25. It was carried over and paid in FY 26. When I went and spoke to DOC and said, well, okay, I know other departments and agencies have problem with the new vendor payment system, so that's understandable. I don't know if that's a particular reason. But when I look at the carry forward numbers from finance and management, I only see 900,000 in that line being carried forward from FY 25 to FY 26.
oh,
So it seems to me that if in fact they did pay it in FY 25, there should be at least 3.1 million should be forward.
right,
It's then only 900,000 is. So when I talked to DOC, they said, well, apparently part of it, in part, they had to pay more for the Pay Act. In other words, Pay Act didn't cover their expenses. And they also put a couple of invoices in there. I said, well, will you send me the detail of that so I can, I understand you probably need to do all of this, but I need to understand it. I have yet to receive it. And that was part of why it was up for correction.
Yeah, good.
Because we were trying to answer some questions. I had to tell them I hadn't received it yet, but they're working.
okay.
So since
Well, this is a good use of, that's why we get the carry forward report,
that's.
so we can see what is actually happening.
So I'm going to keep it open
Yes,
until I can
please.
figure it out. The 4.55 below that, it's just the well path contract that I'm in. It's really two parts. One is the change in census in the correctional facilities. It's gone from like 1250 to about 1450. And so it apparently triggered a renegotiation. And so that's part of it. That's the 3.3 million. And the 1.2 million is an expansion of the substance use disorder program that's also under WellPath. And apparently they were using it for a smaller population, and they've been required to expand it for a larger population within the correctional facilities. So that's the 1.2 million.
Did you ever find out who negotiates these contracts?
DOC does negotiating. They lead the negotiation, but they do have support from the central office.
Okay. This just seems really expensive to me. It is what it is, I
These are things
guess.
that are probably in that contract, that have been triggered.
Yeah,
When you look at the average cost per individual in corrections, it's gone down as a function of increasing the contract.
okay,
It's gone from like 2,600 per person to 2,400 and change per person. Per cost per person.
okay,
But
well,
the
that's,
total cost is.
yeah, okay, that's interesting to know. So their premium health tax credits didn't affect them at all. People paying that a month.
So,
All right, so are we good with accepting the new contract, that's 4.5 million? And we'll hold the other one open. Thank you for getting into that, Trevor.
well,
And then the next batch is Ray. And then we're into one time, Emily, is that right?
Yep.
This is still general fund.
Are some, I believe there are some one times that are non-general fund, but
One time is on page 7 of Adam's spreadsheet, if you want to go along. So this is, first one is the office fit up. That is for the new lease space for Richard's office. Did,
That's different from the lease. It's a split up.
right, and so that can't be capital money, I think it just has to be cash. Is that right? Okay, Emma's nodding her head, so. Well,
Why?
I,
Probably wasn't set up for the,
it doesn't have a 20-year life, but they're so, you know, they're probably trying to minimize how much they use the capital bill for things like this when they can use other. Yeah,
But I think the good explanation is that the lifetime of those bonds, it's 20-year bonds, and this fit up might not last.
right, exactly, yeah. The way we use our desk chairs. You get mad. All right, well. These are all additional costs, but there we are. I was thinking about that, but, all right, so we good on that one?
Yeah.
We're not happy with some of them.
this is
Health
the
department. Is that when you're, this is yours too? Lynn?
No, it went from the Office of Racial Equality.
Yeah, from racial equity to,
Racial equity to the Department of Health.
that's right, we did this last year.
Yeah, and it's, the amount equal to the original appropriated health department to continue activities related to health disparities and health equity.
Right, so it's there, we're finishing up what we started.
Yeah.
Okay.
Good.
All right, everybody all right with that one time? Okay, and then the next one is.
So, you know,
Children and families.
That's-
Child abuse
I keep
hotline.
her on the hotline,
Yep. For 150,000, is that okay, Dave?
yes.
Okay,
And then there's some larger Diva IT chain projects to do with Health Connect.
yes.
I'm not familiar with what's being done, but I certainly understand Health Connect and probably the ongoing work they have to do.
It says Health Connect software must migrate to a cloud-based platform by the summer of 2027 to remain compliant with the security and connectivity requirements of the Federal Data Services Hub.
Okay,
It ensures the support of real-time Medicaid eligibility. So that sounds like something we have to do.
yes.
Okay. And the next one, we're waiting for Emily or Adam or somebody to give us the actual,
I have an updated number,
you do, is it 5.1 or something?
something like that. 5 something.
Yeah. For the Brattleboro retreat, so that's good. And last year it was around 11 million. Because we put it in the budget adjustment,
It's at 5.3.
so it's going down.
5 something.
My notes is 5.3.
It's whatever Adam told me that day, and I told you all what it was. I see. But he might have,
It's 5.3, that's my note as well.
yeah, 5.3.
Going down to 5.3.
But I'm sure you have something official from Adam. and-
Yes, it's going down by 2.6.
So that's nice, especially when we had a downgrade of 8 million, to have a little bit that's,
So it's 5.3.
yeah, but Emily will update it for official.
Okay.
And then we did the other ones. And while we're on a roll, let's just keep going down for the blue section. These are transfers.
Right, to the general fund. This one, the criminal history records check fund is what Tom was talking about. The fees are not keeping up with the expenses of doing the criminal checks, and I have a listing of how the fund has declined and declined and declined over years, and it is in the hole, or will be in the hole, and needs 1.06 to get up to 0. So it's the question, again, the fees are not enough to support the services. And either you go to Ways and Means and ask them to raise the fees, or we decide not to have a special fund and try to do that. This whole discussion that Robin just gave us before. But on the books, it has this great big hole and it needs 1.06 in order to come up to 0.
So what other income there that makes it 1.06 short? Like, is it supposed to be 3.0?
The fees that come in for doing criminal background checks. And there aren't enough of those fees coming in to cover the cost of doing it. I asked them if,
But is that an annual deficiency, or is
No.
it something that's
Well,
accumulated?
it's been accumulating,
Okay.
and there have been instances before. There was another, $109,000 was put in FY 25. And now it's just.
Now it's $1 million?
And now it's $1 million. But it wasn't enough to bring it up to 0.
I wonder what would, so special funds can run in deficit.
Right, and I mean, I remember working before, we just let it sit there with a deficit.
We sometimes
We just acknowledged that it had a deficit.
Right.
And there were a couple times where we went to Ways and Means and said, we figure out some way of doing this. I
Yeah.
remember there was one where to split the fees between Public Service Board
Yes.
and Public Utility Commission. And one was always a deficit because the fee income wasn't either split.
And 70% went one place and 30 went to the
Right.
other.
And so Ways and Means brokered between the two, and they fixed it so it would be
Yeah.
more even.
Yeah.
But
So-
this has only one source of
Right.
fees coming in, and it's not sufficient. And I asked if they could reduce the personnel that are involved in it. They said, no, that would even decrease the responsiveness is. We have complaints about responsiveness in terms of getting those record checks back. And they need well-trained people to do it. This old Joe Schmo off the street, or you can't
Right.
ask another coworker to pitch in and help out. They need some special training in order to do this.
So we could leave it in deficit. But I feel, and so I guess I'm not ready to close it yet.
Yeah.
I just want to think about this now that we have more information, and I also would be interested to see what what is in the FY 27 budget. Which we can take a look at.
We haven't had a fee bill for quite a long time, right?
10 years.
But then Ways and Means could look at who are the payers of this, are the fees being charged really low for these,
Right.
how much for the,
They commented to me that, because I asked if they had ever looked at the fees, and they said, oh, yes, we looked at the fees.
Ways and Means has looked at the.
No, the criminal
agencies,
justice,
okay.
yeah. And they have reviewed what other states do, and they say our fees are in line with what other states do. So it's not as if you could double the fees. I mean, you could double the
Right.
fees. But I don't.
But this gets back to, should we even have, maybe this is a place where you shouldn't even have a special fund, and they should just be part of the regular budget.
Right.
Which is why I'd be interested to see what is in the FY 27 budget.
If they put any money in.
Or, if it's, yeah,
Well, it's probably, they're probably counting on this 1.06 to bring it up to 0.
Yeah.
And then they're gonna operate next year, depending on how many fees come in and how many expenses go out. They'll be in the hole or not, depending.
which is
on-
why this may be a candidate for, should we just get rid of the special fund and throw everything in a general fund? Because otherwise, we're just creating work for ourselves.
Right. I think we need a conversation with JFO or somebody in
Yes.
terms of the
So this.
theory of having special
Right.
funds and why you do it, why you
So,
don't.
so James, will you make a list of things we want to do a deeper dive on in April? And this is one of them. Okay, thank you.
they'll be home by April.
Well, maybe April 30th, but not April Fool's Day. Lynn,
Yeah, I'm just wondering, these are people who are probably getting jobs And they do.
A lot of them are job applicants, I'm sure, or, I don't know, the criminals, they're just
Expanded it over the years.
oh, I think that's the case, yes.
You know, I mean, you have childcare, you have everybody, the teachers, you know, the local church, you have to have a criminal record because you're gonna be with kids and.
Yeah, if you're gonna volunteer at school.
But there are other places you can get this done. That's the problem. There's competition,
Right, because,
retail competition to do this, not the state.
because the total number of them is down, that's why we got a fee problem.
Well, you think up, but even with that, you have a fee problem because you're not,
Not keeping up with the times.
yeah, it's hard to.
Yeah.
But there are other options to go to get a background check.
Information, yeah,
And it maybe it's less expensive for the people who are doing that, but
That's maybe a good question is to find out how many people are.
where you can get it from, how many people are.
That's a good channel.
yeah, that would be an April conversation. But I would like to find out what's in the budget for FY 27 before we totally commit to just doing this. Okay. And then the other conversation I did want to have is the one right below it, to the pilot special fund. So the Agency of Transportation, it's AOT. We talked about the fact that they used some pilot money to do something. Sorry, I've really been very helpful at the end of the day, I can
The
tell.
municipal fire.
It was yes, for municipal pilot. And the deal that Commissioner of Finance and Management said was, you can have this $279,000 from the pilot, which is for municipal stuff, so pilot makes sense, but you have to pay it back. We have a transportation fund that's in deficit, and we're taking $10 million out of the purchase and use to go over the transportation fund. So I think it seems a little silly to ask AOT to pay it back when it's being used for a legitimate pilot thing. So I'm wondering what you all think about that.
Well, Chris and I had a little conversation about that too.
Uh-huh.
Kind of both wondering at the time, after Adam came in to kind of share that. with
Yeah.
us. I feel like you need to ask Adam again, explain that better, why we're doing that, given where we're going here in the next year.
But why is it going to transportation? For what use?
Transportation's paying it back, right?
Well, that's the question is, what are we gonna do? So
Right.
it was used for,
And that's on this new budget.
not enough to cover due to municipalities, reimbursement requests for
They didn't have enough
municipalities.
receipts to cover the cost of what their transportation was paying for.
In
Sounds.
the pilot, if I may, the pilot fund is a pretty significant balance in it right now. It's built up over time. As a way to balance the budget last year, the budget included using $1.5 million or $1.15 million of the pilot special fund by the Agency of Transportation to do some of its municipal projects. So it was a one-off thing to have transportation utilize that fund balance in FY 26 for this purpose. And then I think when they figured, rather than use the transportation fund, it relieved some pressure off the budget this year's fund.
So it's in this year's budget, but then if the cost came in higher,
The cost came in higher, right? And I think in any other year, they would be using transportation, they would have figured it out within the transportation fund, but
right?
just for 2026, they had pilot authorization, so to finish out the projects. They,
So that makes even less sense to me that they should pay it back, because if they'd asked for the full amount the first time, we would have given it to them. Probably, it's pilot. So this is one case where I'm inclined to not make them pay it back. Do you want to do one more check, John?
Yeah, I mean, I emailed Adam about it, wrote back and said it was, because what's this coming out of? Is this really PAA or so like next year's budget? And he says, no, it's this year's budget, but I'll see him tomorrow morning.
Yeah, and just, I mean, he knows that we're thinking of not doing it.
Yeah.
So I don't know if he was just, having a day and then he said, no, you have to pay it back, or another day he might not have, or, who knows? It's not very much money, and it
It's not a
just,
lot.
if they're already in deficit, it just seems like a little unnecessary.
Well, but if you want to stay true to the purposes.
Right.
But they're not having to pay back the other 1.15 million. So that's what I mean, is we're kind of saying, well, it's okay here, but not okay here. but it's an allowable use of the pilot fund
In this fiscal year.
in this fiscal year. Yeah. Okay. All right, so John will find that out. Thank you. Is that all we have, Emily?
I think so.
I haven't really looked at the language, but we have all that, so that's good. Good job, everybody. We're getting close. I think we'll be okay on Friday. She does not come right. A few little dangling items, but. So tomorrow.
We find $15 million somewhere in Eva for our hands of financial relief. I couldn't see it on here.
Emily's coming back with Andrew Stein tomorrow at 11. And what are we talking about? The childcare transfer money?
The year-end closeout.
Okay, okay. So I don't think we need to do markup at 9 AM tomorrow because I don't think you're gonna have answers to the things right now. So, why don't we? Do you have anything else besides we're just doing committee markups? Like there's nothing else that we're waiting for on? Yeah,
So, only other thing is that, Senator Volt is,
oh, that's right. Oh, Senator Wall. Okay, well, she's coming. Okay.
245.
Okay, fine. So why don't we, all of you who have things to do to check out your things and we'll check in at 10 o'clock. That seem all right? And we'll go live and see where we are and see what we need to do. And then we'll have an updated spreadsheet from Emily and Jim. So that's how.